Good afternoon, everyone. Kevin Henderson, Grayson County Judge Executive. Just wanted to update you on COVID-19, Grayson County, April 13th, 2020. As of right now, I'll go ahead and give you the number of the cases. We have 126 total cases that has been tested, total tests that's been done. 105 have been negative. We have 5 positives as of today at 12:30 p.m. 16 tests are still pending. So it's 126 total that has been tested, 105 that have been negative, 5 that are positive, and 16 are pending. I'm going to speak a lot today on some issues that we've been having in the county. Quite honestly, we've had probably 200 to 300 complaints over Easter weekend here over a couple of these positive cases. And we're going to address them and everything that we've done to try to use the best precautions we can to make sure the community is safe. So first, I'd like to introduce Josh Emery with the Grayson County Health Department to talk to you a little bit about what's going on with the health department.
Well, as the judge was saying, I'm going to just talk about some of the things, and as the judge highlighted, we've had several calls, several complaints in the community, and some upset people. So I think it's perfect timing for us to come together and talk about some things. So just to remind the community what happens when someone goes and gets a test for COVID-19. Usually this is done through their primary doctor. The doctor orders the test, and then the results come back positive or negative. The health department is involved in this process, hopefully, when the physician initiates the test in the beginning. So the doctor or someone in the office would pick up the phone or send a fax and let us know at the health department that they are testing someone. The issue with that is we can't guarantee you that that's always happening. So we have to rely on a lot of outside organizations and agencies to collaborate with us and make sure that they are reporting. So what that means is, there may be instances where someone tests and we don't necessarily know that a test has been initiated unless that result comes back as positive. So we can't say we are very confident that we are being told when tests are positive. The issue that we feel that we may have is that some organizations may not be reporting when they initiate tests. So if an individual has been tested, in theory, the physician would tell them, or wherever the testing center, that they need to stay home and isolate until those test results come back, or quarantine. However, we can't guarantee that that's happening 100% of the time because the health department may not be involved in all of those cases. So you may have someone walking around that has been instructed, hey, you have this test out, wait until those results come back before you go anywhere. Wait until those results come back negative. And there are no legal, at this time, there are no legal documents or anything that we can produce to require that person to stay at home until they test positive. So if it looks like that the leadership is lagging or the health department is lagging, I want to reassure you that's not what is going on. We're doing everything we can when we're made aware of every single situation. I'm sure the judge could validate that he and I talked several times over the Easter holiday, as well as the nurses at the Disaster Operations Center was in contact with the judge and county attorney, et cetera, about some of these new cases. So again, if someone has a test result that's positive, then absolutely the health department gets involved in that. We want to be involved in any test that's initiated, and so I'm not only speaking to just the general public, but doctors' offices and testing centers, quick cares, urgent cares, whatever they're called. Please remember to be courteous and let us know when you're testing someone up front so we know. And so that we can call that person and reiterate, hey, wait, stay home until your test results come back and we know that they're negative before you go out into the community. So I know there's concern with positive patients not following quarantine measures, and I know that the judge is going to talk more about that. You know, when a person tests positive, what we do is we give them an isolation order that's signed by me. I am representing the state and the legal organization to say that that person cannot leave their home. If isolation measures are reportedly broken, we investigate it to see if the accusations are true, because that's what they are until they're proven otherwise, just like in a court of law. Those are accusations. We collaborate with local law enforcement in improving compliance. So if we hear of a rumor, someone calls in a complaint, the judge and I talked over the weekend about this, about some rumors. There was an instance where law enforcement literally went to review security cameras to see if those allegations were true. So all this is going on in the background, and the community needs to be aware that we're not idle, that we are taking it seriously. The next thing I'll say is when you call the health department, it's hard for us just to go on hearsay. So based on what you witnessed personally is what we want to hear. If you call and if it's a case of he said, she said, well, that's hearsay, and we can't really go off that. And I think the judge will talk more about that as well. So the last few things I will say, and I hope I've made it clear that the process of positives and the isolation orders and the collaboration and letting you know what's going on behind the scenes, and to let you know that we are aware of all the rumors, has to do with just social distancing measures. And these have been repeated over and over and over again, I know. But there's still some people out there, I guarantee you, that's not following those measures. So let me reiterate. Wash your hands. Use hand sanitizer. Do not congregate. Only go out for necessary items. And if you are sick, do not go out at all. I'll also reiterate the numbers that the judge went over, because when we end these press conferences, it always seems like there's still people question how many tests. So once again, 126 people, to our knowledge, have been tested. 5 positive, and out of those 5 people that have tested positive, 2 have recovered. So they're going about their regular lives. This is hopefully something far in their past. 105 of those tests have been negative, and 16 are pending. Any questions?
Josh, how soon do you think some of those pendings will be in?
We've actually seen the
Right, Josh, if you don't care, repeat the question because people can't hear what Rebecca's question.
Okay, so a reporter asked, Rebecca with the record, asked, what was your question again? I'm sorry.
How soon do you think you'll get some of those pendings back?
How soon will we get some of those pending test results back? We've actually seen an improvement in turnaround. We're going from what we're experiencing 6 to 9 days down to about 2 to 4 days now. So, and that's just a pattern we've noticed. My nurse was actually talking the other day that she noticed that, one of the nurses, that we're getting the test results back a little quicker. So if that continues, then that time frame. Okay? Any more questions? All right, thank you.
All right, thank you, Josh. Josh hit on a lot of it that we was wanting to talk about today. We're basically here. We just wanted to give you an update on the numbers, but we also wanted to squash some rumors. Quite honestly, myself, the health department, Litchfield Police Department, the sheriff's office, just about every police organization in the county was busy all weekend squashing rumors that was brought to our attention. One thing I did want to emphasize is that someone asked me if one of the cases was in connection with an earlier positive. Yes, it was. There was one of the cases that's connection with one of the earlier positives, and that's about all we can tell you about that for patient confidentiality. So the other rumors that we've had is the 52-year-old male that has that tested positive. There has been so many rumors going on, especially on Facebook. If you get on Facebook, I don't see how you can't see them. And the calls that we've received. Quite honestly, folks, we was receiving calls, people saying that they seen this patient inside Walmart and inside retail businesses and all over the county, quite frankly. And I will let you know that the Litchfield Police Department Detective Kevin Smith came out Friday night, Saturday, and yesterday, along with our county attorney, Jeremy Logston. He's here with us today as well. And went and reviewed videotape of every complaint that we received. All was false. This patient was not seen at any of these places of business after we initially found out that this patient was positive Saturday morning. Could they have been somewhere Wednesday or Thursday of that week? Absolutely. We didn't know that this patient had actually tested. Until he tests positive, then the Grayson County Health Department knows who this person is. So there was no way that we could, as leaders or as the health department, could have isolated this person. So we've had a lot of complaints about the leaders need to step up in Grayson County, and quite frankly, if you can throw the arrows at me, I'll take it. I'm the one that decided to run for judge executive. But please don't beat up on our health department. Please don't beat up on our hospital. These folks are doing all they can possibly do, and it's not their fault. They're following the exact same guidelines that is sent down to us from Frankfurt from the governor, and we're trying to do the best we can. Quite honestly, we've never, ever been in a place like this before. And I'll be honest with you, I think we're doing a very good job here in the county. I salute the health department and the healthcare providers and everyone else, every other essential worker that has to be out in this thing. So law enforcement has been contacted numerous times, the health department, 911, the hospital, but we have followed up on every call. We have even had people say that they have seen the patient out, which turns out to be false, because we will have that patient, and I'll let the county attorney explain a little more about this. We will have that person sign an affidavit that they have seen that patient out in public. And every time that we have went to see those folks that has called in those complaints, they will not sign that affidavit because they have not seen that person. It's third-party information. I can also tell you that we have talked to this 52-year-old male patient. We at the Grayson County Health Department have got his car keys. We have got his car keys in our possession, and we will keep them until the quarantine is over. So just so everyone knows, you haven't seen that vehicle out, okay? We are doing everything we can possibly do, and that patient has cooperated with us 100%. Quite honestly, I feel sorry for them because they've received a lot of threats. They've received a lot of bad things happening with them right now. So if you want to do something for them, pray for them. Reach out to them, make sure they're doing well. Any of these patients that test positive, they don't know where they've got it at. They don't have any idea where they've picked this up at. So just be sure and be aware. Some of your statements are pretty harsh, and we need to watch that, folks. We're a whole lot better than that here, a whole lot better than that. But like I said, the vehicle has not been moved since Saturday morning. We know that for a fact. Law enforcement is not setting up on the residence. However, they do drive through about every 15 to 20 minutes. We know for a fact the vehicle has not been moved. So any of the rumors that this person has been to retail places inside the county or anywhere else, they are false. They are false. Right now, I would like to let Jeremy Logston talk just a little bit. And I want to let everyone else know before I let Jeremy talk, I can't count the number of calls and complaints that we've got over the weekend, but I've had some people say I messaged you on Messenger. Folks, I can't answer Messenger right now. I have got so many texts, so many calls at the office, I can't even look at Messenger. I don't even have it anymore. I just have the Facebook page to try to notify everybody. So if you need me, please call me by all means at the office, 270-259-5000. But right now I'd like for our county attorney to talk to you a little bit about some of the other complaints. And like I said, he's been out this weekend too, following up on all these complaints. Folks, we just want to make sure the community feels safe. That's all we want. We want to make sure that we're doing things properly and that you feel safe. So up next is Grayson County Attorney Jeremy Logston.
Good afternoon, everyone. I am Jeremy Logston. Reports of noncompliance of those isolated or quarantined can be very helpful to our community. That information can be used by myself and other entities to take necessary protective actions. However, inaccurate information, hearsay accounts, and fictional claims are not helpful. In fact, they are quite detrimental to our community as they fuel a flame that can grow quickly into a much more dangerous fire by the name of panic. I have been asked to remind those who create these fictions or encourage these falsities of the Kentucky Revised Statute 519-040, falsely reporting an incident. It is a crime punishable up to 1 year in jail to report to law enforcement authorities an offense or an incident within their official concern knowing that it did not occur, or to furnish law enforcement authorities with information allegedly relating to an offense or incident when he knows or knowingly has no information relating to such an offense or incident, knowingly gives false information to any false law enforcement officer with intent to implicate another, or, more importantly, initiates or circulates a report or warning of an alleged occurrence or impending occurrence of an emergency under circumstances likely to cause public inconvenience or alarm when he knows the information reported, conveyed, or circulated is false or baseless. Some people's motivation in calling into the health department or to 911 or to other law enforcement agencies may be good-hearted. However, if this information is not accurate, all it does is draw from our resources, complicate the issue, and make it harder on the individual that is trying to live in our community and follow the rules in isolation. Facebook, information that is transmitted online gets back to this person. Those people who do not provide this information, or this misinformation as it should be called, good-heartedly are doing it with the intent to bully or harass. We cannot suffer bullying. There's been such an effort in our schools to address bullying with children. It goes the same with our citizens. It will not be accepted. My office intends to pursue charges on anyone that maliciously spreads this information to our law enforcement agencies or health department with the intent to harass or otherwise make this isolation on this individual more difficult. I was out this weekend, and I went with Detective Smith to a location in which we spoke with a young lady who filled out an affidavit that this certain patient was at a public location. Upon verification of that information, we went to a very public business, and we reviewed those tapes, guess what? Information was false. The audacity of some individuals during this time of emergency, this time of crisis, is mind-blowing. However, as I've spoke to you before, the common sense and the effort showed by Grayson County citizens warms my heart and gives me confidence that we're going to make it through this together. This is just a bump in the road. The Judge Executive, Kevin Henderson, Josh Embry with the Health Department, and myself all encourage everyone today to keep our chins up and do the right thing. Thank you.
Thank you, Jeremy. I appreciate that. Like I said, once again, folks, we just want to be as transparent as we possibly can be with the county, and with telling everyone exactly what we're doing. This was a little bit out of the norm. Normally, it's just one of those things that happen, and we're dealing with it. And but quite honestly, we have followed up on every single complaint that we have got. Now, we haven't followed up on every comment on Facebook because, quite honestly, we couldn't. But any complaint that someone has called, the police agency, 911, my office, the health department, the hospital, anyone, they have all been followed up on, and they have been unfounded. No evidence of anything. So everyone, just please continue, like Josh has said, let's continue to do the social distancing. I don't see an end in sight I don't think there's going to be a certain day that just pops up and says, all right, we can all go back to normal. I don't think that's going to happen. We'll probably get things going a little bit slower, but quite honestly, I think this thing has changed people's lives forever from this point forward, as far as how we do things with the safety of viruses and disease and stuff. I have a lot of people ask me, they want to know who the patient is. Well, folks, if it was you wouldn't want nobody to know that you had it. I understand some of your all's concerns about, hey, I think the public needs to know. Well, like I've said in the past, it really don't matter who it is, and because people want to know, well, where have they gone? Where have they been? Where have they gone? Well, that really don't matter either. You just need to make sure that just assume that they've been in every retail business in the county. Assume that they have been in every retail business and every convenience store in the county. You need to worry about yourself. You need to protect yourself. This is about what we can do as a community, but we've all got to do it together. And you've got to use the social distancing, washing your hands, and like I've said, you need to treat everyone as if they have the virus. So when you ask that question, well, where have they been? Have they been to Walmart? Have they been to a Dollar General store? Have they been to a convenience store? Yes, I'm sure they probably have. Because before they got tested, they probably didn't have any symptoms, and they had no idea that they had it. Zero idea that they had it. We're seeing people all over the country. One of our senators, Senator Rand Paul, said he had zero symptoms. I just seen that on the news. He had zero, didn't have a symptom, but he tested positive. So, he's got to get gas. He's got to go to the store. He does things like that. So just assume that these folks have been in these businesses and treat everyone as if they had it. But I want to say, most of all, that I'm proud of the way most people in the county have conducted themselves. It's been tough on everybody. Everybody's anxiety level is out of the roof, and quite honestly, mine is too. Love to see everything go back to the way it was, but folks, I think it's going to be a little while. So let's just buckle down, do what we're supposed to do, hang on, and we will get through this. We will get through it together. But I want to make sure that everyone knows that I mentioned Darren Dennison in the last briefing. Darren Dennison is off the ventilator, thank God. And He's off of the ventilator and doing very well. And thank everyone for their prayers. And I know his wife and his family really thanks you a lot for that. And let's all remember our neighboring county, Butler County. They've been hit extremely hard, with their old age home down there, the elderly home that they have. And I think they've got over 50 cases. So everybody remember them. I mean, they're our neighbors. All these surrounding counties, they're our neighbors. So, let's remember them folks. So if anyone has any questions, do not hesitate to call the health department, 270-259-3141, or my office at 270-259-5000. If they do see somebody out that has been self-quarantined, please, we're urging you to call us and let us know. But if it's just third-party information, if it's just rumors, folks, keep it to yourself. We don't want to hear about it because we want to know facts. We want to know to make sure that we're doing our part to keep the community safe. So other than that, thank you all. Just pray that the Lord will get us out of this. Pray every day. And thank you all, and God bless.